Welcome back, everyone, to the Elevate Wellness Podcast. My name is Gil. We have Vivian with us today, as always. And we are going to be discussing a topic of interest as of late, which is type of injections. People are always reaching out asking, is there a difference between intramuscular versus subcutaneous injections? And the answer is, for the most part, yes, there is a difference. Just how big of a difference it is, it comes down to the individual, but we're going to try to break down a little bit of the differences of not just the location and the type of injection, but we're going to discuss a little bit, frequency and dosing, not so much per milligrams, but in terms of volume and why different volumes of injections matter. So we're going to start out with essentially a conversation about the most commonly asked question. And being that Vivian does a majority of the clinical assessments with our patients, she's going to tell us a little bit about what sort of questions you get the most when it comes to injections in general, as far as location, as far as frequency, as far as sub-Q versus IM. Like what are the most common 2 or 3 questions that you find patients generally ask you when it comes to injections in general?
I think it's fun that I've been doing this long enough now that I'm seeing trends. Like in the last 4 years, the trends have shifted, and it's mainly bounces off of what people are talking about on the internet. So lately, this whole thing has been, should I do, sub-Q microdosing daily, right? Which really irks me. But I'd say the top 3 most common questions are, how much should I inject? Where should I inject? How often should I inject? What kind of needle should I be using? So those questions come up pretty frequently. And unfortunately, these men are trained that because everybody's on 1 shot a week and then that doesn't work. So the doctor will say, okay, let's split it up and do 2 shots a week. And then that doesn't work. And their provider will say, well, I guess this just didn't work for you. So sorry, we're going to take you off treatment.
Do you think that the fact that they're on 1 shot a week, obviously they're taking a larger bolus or a single volumetrically bigger injection because of that 1 shot? Do you think that's partially the reason why a lot of guys are using larger syringes and larger needles? Because if you were to inject, let's say, a full cc of oil through an insulin needle, that would take a while to draw, would take a lot to inject, it would require a lot of pressure. You would have a lot more shallow fluid, under the skin or in a shallow muscular layer. Do you think that the reason a lot of guys are getting these 23 gauge 1 inch or 1.5 inch, it's because they're injecting 1 cc at once?
Probably. I mean, and I had a guy yesterday, he was like, oh, I'm allergic to the oil that it's in. I was doing 1 cc a week. I said, you're not allergic to the oil that it was in. You're injuring the tissue because you're applying so much force to push that oil through the syringe to get into your tissue, and now it's sitting there like a lump and it's causing a lot of irritation. It wasn't the oil, it was the technique and the fact that there's so many reasons why 1 dose a week is wrong. And this is one of them, is that putting that big amount of oil. A lot of guys don't understand this that haven't started. Testosterone is like the consistency of olive oil. And when you inject that much oil into an area, it's going to hurt. Like your body's like, what is this? What do I do with this? How do I disperse this? So that's just a lot at once. And if you're using a large needle to stab your skin to get that stuff in, it's a lot of trauma.
Right. There's scar tissue that builds up over time. Think about it. If you're in your 40s and you're going to be injecting for the rest of your life, presumably, you're talking about thousands of injections in relatively the same spot, even though you can, alternate a couple spots. Ultimately, you're going to be doing a couple thousand injections in the same spot. So the scar tissue buildup concern is real. Right. And the less invasive you can make each injection, the better in the long term. So obviously, there's many benefits to splitting injections depending on the frequency based on SHBG, which is a whole nother conversation, which we always touch on. But one of the other benefits is the fact that you get a smaller volume of injection per injection, meaning you have less to worry about in terms of nodules, site irritation, discomfort, etc. And it's a lot easier to draw and inject in a much smaller syringe or needle when you have less volume, obviously. So that's another benefit. As far as the subcutaneous versus intramuscular, right? A lot of people don't realize there are essentially 7 layers to the skin. Mm-hmm. And they're broken down into what we call sublayers, which make up the 7. But on the big picture, we have the epidermis, which essentially contains 2 layers. Then we have the dermal layer, which is the central layer that contains most of the nerve endings in the skin and some vascularity. Then you have the hypodermal layer, also called the subcutaneous layer, which is made up of lipids or fatty tissue. And then underneath that, you have your muscle layer, and there's some fascia in between there. And when you're utilizing a relatively muscular area, like a lateral delt or a ventral glute, which are areas that don't generally contain a whole lot of fat compared to some other areas, you're going to usually hit what we call shallow intramuscular when you're using a 1/2-inch insulin syringe or needle, like a 27 gauge, which is what we favor. And the reason that I like, personally, intramuscular injections over subcutaneous is the hypodermal layer, or the subcutaneous fatty layer, has a lipid layer in it, and the oil contained in the testosterone, the carrier oil, is a lipid layer. So oil tends to be what we call hydrophobic or lipophilic, which means that it absorbs better into oil. The muscular layer is full of water, whereas the fatty layer is full of lipids. So the lipid injection tends to sit and settle in that lipid layer, in the hypodermal or subcutaneous layer. And it tends to create a nodule because it takes longer to absorb. It's a slower process, and therefore it's more irritated because it sits longer. It also is closer to the surface of the skin, which creates more of a lump. And because it absorbs slower, it also tends to lump a little bit longer. Once you get into the muscle tissue, not only is it now hydrophilic because it is absorbed better, you also have more vascularity in muscle tissue than you do in fat tissue. So overall, there are physiological benefits to injecting into the muscle. So that little needle will be sufficient to get into what we call a shallow intramuscular injection without any pain and without any risk of scar tissue long term. Most of the pain sensors are in the dermal layer. You're piercing through that either way. It's a tiny little pinch sometimes. Sometimes you don't feel it at all. The deeper you go, it doesn't matter at that point. But there is scar tissue to be done when you keep poking into muscle. So that's my take. I have a 40-minute video on our website in the knowledge base section, elevatewellnessgroup.com, with full photos and slides explaining the layers of the skin for the nerds out there who truly want to learn a little bit more. But what's your take as far as real-world feedback from patients who've gone through subcutaneous injections? A lot of them tend to do the belly, and then guys that have switched over to our protocols, like video number 68 on our website. What's your take from there, or their feedback?
Well, I mean, truly, I see good numbers with both. I personally don't like the subcutaneous injection in the stomach. Like you said, it causes nodules. I always laugh with my guys who are in warmer climates, or even now, we're getting into summer months. I'm like, it's bikini season. You don't want bruises all over your stomach. It looks like you got hit with a paintball, because it leaves a knot and it bruises. It doesn't look nice and it hurts. I mean, it makes your skin sore. So for that, I don't love it, but I do see good numbers with both. I always say, I'm like, look, I don't live with you. If you want to stab yourself every day, that's fine. There's just no need for it. I mean, if you rotate sites, my favorite spot is the hips, just underneath the hip bone. I guess that's like I call it that, the hip or the high butt, more the ventral glute. It doesn't hurt. It's easy to do. A lot of guys can't turn to really do that, like top of the ventral glute, because they have back problems or, I don't know, neck problems, whatever. So I really find that that's a better spot, and it doesn't hurt. And if you do leave a bruise, you just pull your swim trunks over it. So it's essentially like nobody sees anything.
I've had success doing ventral glute injections even sitting down, right, where you really don't even have to twist or worry about it. So it's just literally where your side pocket of your jeans would begin. It's very simple. Guys always say, well, it feels a little bony, or at least the thinner guys just say it feels a little bony. You're not going to hit a bone. You're really not with a 1/2-inch needle. And frankly, if you hit a bone, it's not the end of the world. I mean, when we do neurotoxin injections, we're hitting bone all the time. Mm-hmm. So it's not that big a deal. The needle's not going to break, and it's not going to hurt you.
A lot of guys, I'll laugh because they'll say, I took a shot and I bled. What do I do? I'm like, well, congratulations, you're alive, and you stabbed yourself with something sharp.
A hole in a living organism, and it bled.
Right, and it bled. Right. Or actually, another common question they'll ask, I took a shot and some came out. Do I need to do another one? Did I lose some of the dose? What do you say to that?
No, you don't have to worry about them. If you just sat there and watch it seep out for 10 minutes, perhaps, but a little bit that comes out, it's mostly from retracting the needle. And and if you feel, what I like to do is I tell guys, when you're done injecting, hold it for another 5 seconds. And when you retract, just massage the area. That's all. Or lift your arm and then the muscle contracts and it's gone. They could also Google something called the Z-track method if they'd like. If you're doing it on the hip, you can use your thumb to pull, you inject, and then as soon as you retract, you let go. Skin bounces off and it creates it seals the exit, essentially. So people... We've talked about this in another episode. People love to dwell on every micro and minute detail of a new treatment because they like to blame or contribute, the cause of every change in their life to their new treatment. And I always say, just relax, forget you're on treatment. Again, you didn't think about testosterone when you were in your 20s. You just went about life and everything was great. And now all of a sudden you're injecting the testosterone and you're thinking about it all day. Go back to 20 years ago, think about life and forget you're on treatment. Not everything in the world revolves around your testosterone therapy. Not every change that comes about is related to testosterone. So they're always trying to play with it. And, I find that they're just inducing anxiety. Our best patients that report the best outcomes are the ones who are just compliant and forget they're on treatment.
Just take your shots when you're supposed to and go about your life. I'm like, stop overthinking this. You're making yourself crazy for no reason. Just take your injections when you're supposed to and move on.
Overthinking it leads to more anxiety, and oftentimes they come to us to resolve anxiety, and then they're in their own head generating a little bit more. So we do our best to educate via videos, podcasts, information, talking about hot topics. But at the end of the day, it's up to an individual to relax, take a breath, relax, enjoy the present. Don't worry about your treatment all that much. That's what you pay us for, so you don't have to worry. It's our job to worry.
Well, I'll say to them, when I was on blood pressure medicine, do you think every single day I was like, oh, my blood pressure medicine? I'm like, no, I took it in the morning and I went about my day. I didn't really think about it that much. You check your blood pressure once in a while, you're good. Okay, everything's fine.
And why are you not on blood pressure medicine anymore?
Am I supposed to answer this truthfully? Hormone replacement.
Exactly.
Yeah. Of course.
Yeah, of course.
Estradiol, specifically, lowers blood pressure.
In your case,
Reverses
and for men, estradiol comes from aromatization, from optimal testosterone management.
And that's what lowers blood pressure.
Yeah.
Not causes man boobs.
Right, because a lot of age-related hypertension is a result of the resistance that comes in the endothelium lining of the veins and arteries, the hardening, the calcification, the inability for the smooth muscle, which is what the endothelium is, to expand and contract. And sufficient levels of estradiol from aromatization as a result of optimal testosterone level helps to reverse that damage. And a lot of guys that we've had optimized on testosterone have been able to slowly remove their blood pressure medication. Testosterone is also a phenomenal nitric oxide booster. Any anabolic hormone or any anabolic environment relies heavily on nitric oxide levels. So the more nitric oxide you have, the better your vasodilation is. And with age, we lose nitric oxide. That's why we become more catabolic. So stuff like L-citrulline coupled with optimal testosterone coupled with low-dose daily tadalafil, you have a nitric oxide heaven and reversal of hypertension. Right. Yeah. So what else? What else do you find with guys that start testosterone and trust your guidance and they're patient and they're not rushing the process? What do you find in month 3 or at month 6 or at month 12? The most common thing that the guys who learn to relax and not dissect every little detail, what did they experience?
So that's the most important thing I always harp on. I'm like, look, I know you don't feel good. I know you want to feel better tomorrow. I know you're, following people on social media. Your friend's done this and they look great. And now you're playing the catch-up game. So try not to rush the process. It's a slow process. It didn't take you 6 months or a year to get into this spot where you're finally deciding to get on therapy. It may take 6 to 12 months to get you out of the woods. That's why I always say, please give this a year of proper treatment. I promise you, if you're trying to do the right thing most of the time, this is a home run. So within 6 to 12 months, especially guys that I see that they're on a couple blood pressure medications, a metformin or some blood sugar lowering medications, a statin, of course, it's always the trifecta, right? So when I see those things, I'll say, keep an eye on your blood pressure. Go to the store and get yourself a cuff. Make sure that cuff is the right size. If the cuff's too small, typically your average blood pressure cuff in the store is made for a little old lady with a 12-inch bicep. That is not my average patient. A man Typically, men don't have 12-inch biceps, but you need a large cuff so that it's taking an accurate measurement for you. Within 6 to 12 months of optimal therapy and trying to do the right thing, your blood pressure will come down. You will be over-medicated on blood pressure. I can advise you, I can't tell you to stop taking your blood pressure medicine, but the first thing I'm going to ask you to do is bounce this off of the provider that prescribed you those things, and then you can start cutting back. And guys will say, well, I'm scared to stop taking it. I'm like, well, here's the beauty of blood pressure medicine. I've managed blood pressure for years with a kidney doctor and open heart surgery. If your pressure goes up, you just start taking medicine again, and in a couple of days comes back down. It's pretty easy to manage. But when you're over-medicated on blood pressure medication, it can really mimic side effects of low testosterone, like fatigue, afternoon tiredness, being tired at night, feeling dizzy. That's not a good feeling. But when your blood pressure is too low, you're not perfusing your organs well, and you feel bad. So I'll say, please keep an eye on your blood pressure twice a week. Again, back to being neurotic about everything. You don't have to check it every day. Check it a couple times a week. If you're seeing better numbers, talk to your doctor about cutting back on your blood pressure medicine. There's no reason why you can't get off of it. Same thing with statins. But providers push back on this. Well, it's good for you. It's good for long-term health. Your father had cardiovascular disease, or your mom has high cholesterol, stay on that statin. So you're going to get some pushback. And this is where I tell people you might need to be your own advocate and kind of decide what you want to do and then go from there.
A lot of guys obviously have an ego where they're being told, hey, you have a particular condition and here's the fix for it on a medical level. And they say, well, I'm going to try to do it myself. I'm going to lose weight. I'm going to eat better. And usually what happens, 3-6 months go by and obviously nothing changes. What would you say to guys who have been hypertensive for an extended period of time? Firsthand, being in nephrology and cardiology, firsthand the damage it does to both the kidneys and the heart. What sort of damage, so they understand the extent, untreated hypertension, both for renal function and cardiovascular function, what sort of damage occurs over the course of time if they refuse to treat the problem?
Oh, you're saying guys that are not on any medication at all?
They say, no, I don't want to take any blood pressure medication. They're continually, 160 over 95. And what happens to their kidneys and their heart over time? What do you say?
Well, first and foremost, these guys I call them that we get on the phone with for treatment, I'm like, well, you got to go to the doctor. I can't treat you because you're at a huge risk for me legally. Not only for you, but for me, you're at a risk legally. You need to get in touch with your health, and you need to find a doctor and go and, please just get on medication for 6 to 12 months. Eventually the testosterone, hopefully, if you're trying to do the right thing, will take over, and then we can either pull back or get you off that medication altogether. But the problem with the kidney, it's a very sensitive organ, and what it does every day is incredible. But there's one way in and one way out. There's a renal artery. When that renal artery is tightening up because your blood pressure is high, you got a little high cholesterol, you might have a little prediabetes, now you have metabolic syndrome, you're not getting good blood flow to that organ, and it just fails. Every year after 50, we all lose 1% of kidney function. So your creatinine is going to go up anyway because we're getting older. An older organ doesn't work that well. Now you're adding all these other factors into the mix, and you're really diminishing blood flow to the kidney. They just don't work. And the problem is every time you insult that kidney, it never fully recovers. On top of the fact you're going to lose 1% of function every year after 50. So this is why people go on dialysis. And then once you get on the machine, your mortality rate goes up by 20% a year. Your average dialysis patient only lives 5 years. And God forbid you miss one treatment, now you're off the transplant list. If you're non-compliant with dialysis, you cannot get an organ. They just don't give them to you because you're not the best candidate for it. And then also, going to dialysis 3 times a week, these people can't work any longer. They're exhausted on their days off of treatment. You can't travel. The depression is really, really bad. It's a death sentence. It really is. So the best way to keep yourself off the machine is not only to keep your blood pressure and your blood sugar in check, but then honestly, getting on testosterone will really help.
And on the cardiovascular side, what do you find as far as like left ventricle hypertrophy, cardiomegaly, et cetera?
I've been in the OR with these guys that have, refused to take blood pressure medicine for years, or they sort of take it, sort of don't go on a CPAP because they have sleep apnea. The heart is so big when they pop the chest open, all you see is left ventricle. And it actually starts pushing out of the incision. It's insane. And then there's fat all over the heart. It's actually disgusting. I wish I had picture. I mean, you can go on the internet and see pictures of this stuff, but if you saw your own heart looking like that, you would have a much different idea of taking care of yourself really does. And the surgeons would say, like, yeah, see this, see that. Like, you can actually see when the left ventricle is that big, you can see the main arteries that are supporting it to help it stay alive. You can see where they're blocked. You can see the new veins and arteries that are trying to move around the blockage. I mean, your body tries to fix itself. It makes collateral circulation to try and feed that muscle so it actually can pump and keep you alive. And it's mind-blowing to see it really in living color. So that's what I think of when I have a guy that's, 5'10", 220. He's clearly has sleep apnea. He's got high blood pressure. He's like, well, I'm all muscle. I'm like, yeah, I know exactly what your heart looks like when they cut your chest open, and you're not all muscle. Your heart's huge, and your body's struggling.
Yeah. Well, I think that covers a lot of this topic for us. One bit of good news is we've recently went and hired some additional staff to help support the demand of incoming patients that have expressed interest in therapy with us so that we don't have a backlog of intakes. And we've...
Can we touch on that for a minute?
Sure.
People are complaining about they have to wait 2 weeks to speak to me. I just tried to make an appointment with a dermatologist. 2 months. 2 months. I said, please, I'll pay out of pocket. Don't run my insurance. I'll pay you out of pocket, please. Sorry, ma'am, that doesn't matter. Or they're just not taking me at all. I'm sorry, we're not taking new patients. Well, what do you mean? I'll pay you out of pocket. Nope, not taking new patients.
People don't realize how scarce a good quality specialist is.
I hear it. They have to wait 10 days.
And I'm over here saying I don't want our patients to wait 2 weeks, which is why I'm continuously trying to hire and train more staff. But honestly, guys, look, you've been waiting presumably a decade, sometimes, a couple of years,
right.
20 years, whatever it is, neglecting this situation, and then finally you are at a crossroad where you can have literally the best people in the country in this field treating you. Give it to 2 weeks, give it to 3 weeks, give it a month if you have to. We will get to you, I promise. And we are making strides. We're trying to hire and train. We will not sacrifice quality for quantity. What I mean by that is we're not just going to take someone who says, hey, I got 10 years experience in hormones, I'm ready to run tomorrow. I put every provider that starts with us through a 2 to 3 month extensive training process with lectures in a classroom, with role-playing lab reviews, with shadowing, listening to consultations in real time for weeks to months before we set them loose confidently to be able to treat you correctly. So bear with us, but I do encourage you to go on elevatewellnessgroup.com, drop your contact information in there. We will give you a call within 24 business hours, and we will get the process rolling for you as quickly and efficiently as possible. But rest assured, we will not sacrifice quality for the sake of getting you in sooner, because your health is the most important thing to us. So as always, thank you for your vote of confidence by watching the content we put out there, and we look forward to helping you in the near future.